Good evening, friends. Welcome back, everyone. Today is July 8, 2026, and we are tracking some of the most monumental shifts in global healthcare we've seen all year. If you or a loved one are tracking updates on cancer research, major FDA decisions, or neurology breakthroughs, you need to pay close attention to today's news. We are breaking down a staggering new warning from the World Health Organization, a brand new FDA approval for a progressive chronic disease, and a mind-blowing discovery involving creatine that is turning oncology research on its head. Hit that subscribe button, and let's dive right in. Segment 1, the WHO's Urgent 2050 Cancer Warning. We start today with a major wake-up call from the United Nations. The World Health Organization, WHO, just released its Global Status Report on Cancer. The headline? Global cancer cases are projected to nearly double, surging to 35 million new cases annually by 2050. Right now, cancer claims over 26,000 lives every single day. But the core of the WHO's warning isn't just the numbers, it's the terrifying gap in global equity. For instance, in high-income nations, the 5-year survival rate for breast cancer sits at 85%. In lower-income countries, it plummets to under 30%. Furthermore, the report revealed that 23 countries currently have zero radiation facilities, and up to 90% of patients in lower-income areas are forced to abandon treatment entirely due to catastrophic financial hardship. The WHO is calling for an immediate, aggressive global pivot toward localized prevention and people-centered healthcare to stop this trajectory. Segment 2, Big FDA Approvals, Trutacna and MedTech Advances. On the regulatory front, the FDA has been incredibly busy over the last 24 hours. First up, a massive win for chronic kidney disease patients. The FDA has granted accelerated approval to Trutacna, a tazecept, developed by Vera Therapeutics. Trutacna is now officially the first dual BAFF/APRIL inhibitor cleared to treat adult patients with primary IgA nephropathy. This is a progressive autoimmune kidney disease that, left unchecked, forces half of its patients into total kidney failure or dialysis. In its late-stage Origin 3 trial, Trutacna delivered a massive 46% drop in proteinuria. Because it's a self-administered injection, it gives patients an entirely new level of independence. But that's not all for the FDA. Johnson & Johnson just announced official FDA approval for their dual-energy Thermocol SmartTouch SF platform. For anyone dealing with atrial fibrillation or irregular heartbeats, this is a game-changer. It allows electrophysiologists to deliver both radiofrequency and pulsed field energy through a single catheter, making heart ablation surgeries faster, safer, and much less invasive. Segment 3, Breakthrough Science, Creatine and Motor Neuron Disease. Now, let's talk about the absolute mind-bending science making waves in peer-reviewed journals today. For years, we've known creatine as the ultimate gym supplement for building muscle. But according to a stunning new study published today on Science Daily, creatine may actually be a secret weapon in the fight against cancer. Scientists discovered that creatine supercharges the immune system's primary cancer-fighting pathways. Specifically, it energizes dendritic cells, which are the specialized cells responsible for activating killer T cells to destroy tumors. This could pave the way for creatine to be used alongside immunotherapy to drastically increase patient success rates. Meanwhile, in neurodegenerative news, researchers at the University of Queensland in Australia have announced a monumental breakthrough for motor neuron disease, MND, Parkinson's, and Alzheimer's. They have successfully engineered a brand new molecule called R8Y. This drug targets a highly specific immune receptor, C5AR2, to halt aggressive, hard-to-treat neuroinflammation. It's a completely new blueprint for treating diseases that have baffled science for decades. Segment 4, Quickfire Medical Round. Before we wrap up, let's hit today's quickfire medical headlines. Asterisk the diet debate. A fresh study comparing intermittent fasting to traditional calorie counting found that fasting yielded identical weight loss results but with vastly less mental stress and fewer feelings of deprivation. Asterisk FDA Food Safety Alert. The FDA has issued an ongoing safety advisory regarding an E. coli outbreak linked to frozen organic blueberries. Frutas y Hortalizas del Sur has recalled Green Wise brand organic frozen blueberries sold at public stores across 8 U.S. states. Check your freezers. Asterisk Asthma Tech. Clinical data highlights that the rapid adoption of pheno-testing devices, like the Enabreathe monitor, is successfully shifting asthma care away from blue rescue inhalers and toward preventative combination therapies, saving patients from sudden asthma attacks. Cancer. Did you know that age is the single biggest predictor of your chances of getting cancer? It jumps up after you hit age 50. Half of all cancers happen in people over age 65. For lung cancer, the median age is 70. Scientists don't know exactly why older people are more susceptible to cancer. It could simply be that you've been exposed to cancer-causing agents for longer. Or maybe your body is less able to make repairs when cells go haywire. WebMD. NICU. Results of this systematic review and meta-analysis suggest that, given several effective interventions to reduce parent mental health symptoms in the NICU, hospitals should consider implementing those that require few additional resources such as family-centered care and education, and those that have the most consistent benefits across mental health outcomes, which were psychotherapy and emotional support interventions. JAMANetwork.com. Dengue vaccine. A study by Ranzani and colleagues demonstrated that the two-dose series of TAK-003 provided significant vaccine effectiveness, 61.7%, against symptomatic virologically confirmed dengue in a real-world setting. Medscape. Outro and call to action. From a staggering 2050 cancer roadmap to groundbreaking new tools reversing kidney and heart disease, today, July 8, 2026, proves that medical technology is moving faster than ever. I've left the official links to the WHO report and FDA approvals in the description below so you can check them out. Which of these breakthroughs surprised you the most? Let me know in the comments, drop a like if this was helpful, and I'll see you in the next video. Stay healthy. Description links, WHO Cancer Report Announcement, and the FDA Drug Approvals Directory, https://www.drugs.com/newdrugs.html. Disclaimer, compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.